Let's start by understanding what vitamins actually are. Vitamins are organic compounds, meaning they contain carbon that our bodies need in very small amounts to function properly. They don't provide energy themselves, but they help our cells do what they're supposed to. You can think of them like facilitators or coordinators. They help enzymes do their jobs. They stabilize cell membranes, support vision, blood clotting, bone health, immune function. The list goes on. Vitamins are essential because our bodies either can't produce them at all or can't produce enough to meet our needs. For instance, we can synthesize a bit of vitamin D through our skin using sunlight, and our gut microbiota produces some vitamin K, but generally, we rely heavily on our diet to get all our vitamins. That's why dietary variety is critical. Another key point: vitamins are classified as micronutrients. This distinguishes them from macronutrients like proteins, carbohydrates, and fats. But don't let the micro fool you. The consequences of not having enough of these micronutrients are anything but small. Deficiencies can lead to serious diseases, and we'll dive into those today. You'll also hear the term provitamin, which refers to substances that the body can convert into active vitamins. For example, beta-carotene is a provitamin A. One more thing to remember: vitamins can be destroyed by heat, light, or improper storage. So even if your food contains vitamins, improper cooking can reduce their bioavailability. This is especially true for vitamin C, which is quite heat-labile. So, in essence, vitamins are indispensable, non-energy-yielding organic molecules that regulate metabolism and support the structure and function of our body. When we talk about the features of vitamins, it's helpful to compare and contrast them with other nutrients. Unlike carbohydrates, fats, and proteins, vitamins don't directly supply energy. However, they're crucial for the metabolic pathways that help release energy from those macronutrients. Most vitamins function either as coenzymes or precursors to coenzymes, which are essential components of enzymes. Without the right vitamin, many enzymes can't function. A great example is vitamin B1, which is part of thiamine pyrophosphate, a coenzyme involved in carbohydrate metabolism. Another feature: specificity of function. Each vitamin tends to serve particular roles. For example, vitamin A is critical for vision and epithelial tissue maintenance, while vitamin D helps regulate calcium and phosphate metabolism. Most vitamins are not synthesized in sufficient amounts, hence the term essential. Exceptions include vitamin D, partially synthesized via skin; vitamin K, partially from gut flora. Niacin B3 can be made from tryptophan but not in sufficient amounts. Now, let's talk about deficiencies. Vitamin deficiency diseases are often named distinctly, like scurvy, vitamin C, rickets, vitamin D, or pellagra, niacin/B3. These diseases can have overlapping symptoms such as fatigue or weakness, but each has hallmark features. It's also crucial to understand that overconsumption of certain vitamins, especially fat-soluble ones, can cause toxicity, known as hypervitaminosis. This is especially true for A and D, which are stored in the liver and fatty tissues. In summary, vitamins are small in quantity but massive in function. They act like keys that unlock metabolic processes vital for life. Let's classify vitamins now, which will help structure our entire discussion today. The primary classification of vitamins is based on their solubility: fat-soluble and water-soluble. Fat-soluble vitamins, A, D, E, and K, dissolve in fat and are stored in the body's fat tissues and the liver. Because they can be stored, we don't need to consume them every day, but that also means they can accumulate, leading to toxicity if taken in excess, particularly through supplements. Water-soluble vitamins include the entire B-complex group and vitamin C. These dissolve in water and are not stored to any significant degree in the body. What you don't need is excreted in urine, which is why you need a regular dietary intake. Water-soluble vitamin deficiencies tend to show up more quickly than fat-soluble ones because there's little reserve. Now, looking at the B-complex vitamins, each has a unique function and deficiency syndrome, so they're not just one entity. For instance, B1 thiamine helps in energy metabolism and nerve function. B2 riboflavin is involved in redox reactions. B3, niacin, is key for NAD/NADP synthesis. B6, pyridoxine, is crucial for amino acid metabolism. B9, folic acid, and B12, cobalamin, are central to DNA synthesis and red blood cell formation. Vitamin C stands alone among water-soluble vitamins. It's not a B vitamin, and is vital for collagen synthesis and antioxidant defense. This solubility classification also affects clinical approaches. For instance, treating someone with a malabsorption syndrome like celiac disease, you'll worry more about fat-soluble vitamin deficiencies. On the other hand, in cases like alcoholism, you'll often see water-soluble vitamin deficiencies, especially B1, B6, and B12. So, keep this classification in mind as it impacts how these nutrients behave in the body, how they're absorbed, stored, and how quickly deficiency symptoms appear. Now, let's discuss vitamin A, one of the most well-studied fat-soluble vitamins, essential for vision, growth, and immune function. Vitamin A exists in two main forms: preformed vitamin A retinol and retinol esters, found in animal products like liver, dairy, and fish oils, and provitamin A carotenoids such as beta-carotene, which are plant pigments found in colorful fruits and vegetables like carrots, spinach, and sweet potatoes. Our body converts beta-carotene to active vitamin A, though this conversion efficiency varies among individuals. One of the hallmark functions of vitamin A is its critical role in vision, specifically in the retina. Vitamin A is a component of rhodopsin, the visual pigment found in rod cells, which are responsible for low light and night vision. Without sufficient vitamin A, the regeneration of rhodopsin is impaired, leading to night blindness, often the earliest clinical sign of deficiency. Vitamin A also maintains the integrity of epithelial tissues, including skin, respiratory tract, and gastrointestinal tract lining. It supports the differentiation of epithelial cells and production of mucus, which forms a protective barrier against infections. This explains why vitamin A deficiency can lead to increased susceptibility to infections, especially respiratory and gastrointestinal. Deficiency can progress from night blindness to more severe conditions like xerophthalmia, where the conjunctiva becomes dry and develops characteristic Bitot spots, foamy accumulations of keratin debris. If untreated, this can advance to keratomalacia, a condition where the cornea softens and may lead to irreversible blindness. In children, vitamin A deficiency is a major public health problem in developing countries and is a leading cause of preventable childhood blindness. Supplementation programs have been shown to significantly reduce morbidity and mortality from infectious diseases, such as measles. On the other hand, hypervitaminosis A results from excessive intake, especially through supplements or liver consumption, leading to symptoms like headache, nausea, dizziness, and even raised intracranial pressure. In summary, vitamin A is vital not only for vision but also for maintaining healthy skin and mucosal barriers and supporting immune defenses. Its deficiency presents with classical ocular signs, making it one of the vitamin deficiency diseases you must remember clearly for exams as well as for practical clinical knowledge. Let's move on to vitamin D, often called the sunshine vitamin because our bodies can synthesize it when our skin is exposed to ultraviolet B rays from sunlight. This feature makes vitamin D unique among vitamins. Vitamin D actually refers to a group of fat-soluble secosteroids, primarily vitamin D2, ergocalciferol, from plant sources, and vitamin D3, cholecalciferol, produced in the skin and found in animal sources like fatty fish, liver, and egg yolk. Once synthesized or ingested, vitamin D undergoes two hydroxylations, first in the liver to form 25-hydroxyvitamin D, calcidiol, and then in the kidney to form the active hormone 1,25-dihydroxyvitamin D, calcitriol. Calcitriol plays a critical role in calcium and phosphate homeostasis by increasing their absorption in the intestine, promoting bone mineralization, and modulating parathyroid hormone secretion. Because of these functions, vitamin D is essential for maintaining healthy bones and teeth. Deficiency in vitamin D leads to impaired calcium absorption, which triggers secondary hyperparathyroidism, increasing bone resorption and resulting in weakened bones. In children, this manifests as rickets, characterized by soft and deformed bones, delayed growth, bowed legs, and sometimes delayed tooth eruption. In adults, the equivalent condition is osteomalacia, where bones become fragile and prone to fractures. Several risk factors increase the likelihood of vitamin D deficiency, including inadequate sunlight exposure due to geographic location, cultural clothing practices, sunscreen use, darker skin pigmentation, which reduces vitamin D synthesis, and malabsorption disorders such as celiac disease or chronic kidney disease. Vitamin D toxicity is rare, but can occur with excessive supplementation. It leads to hypercalcemia, which causes nausea, vomiting, weakness, and kidney damage. Clinically, measuring serum 25-hydroxyvitamin D levels is the best indicator of vitamin D status. Understanding vitamin D's role is vital, especially as we encounter increasing cases of osteoporosis and fractures in aging populations. Supplementing at-risk groups is a common preventive strategy. For NEET aspirants, remember, vitamin D deficiency causes rickets and osteomalacia, marked by defective bone mineralization and associated skeletal deformities. Moving on to vitamin E, a fat-soluble vitamin primarily known for its potent antioxidant properties. Vitamin E is a collective term for a group of compounds called tocopherols and tocotrienols, with alpha-tocopherol being the most biologically active form in humans. Its primary role is to protect cell membranes from oxidative damage by scavenging free radicals, highly reactive molecules that can damage lipids, proteins, and DNA. Because of this antioxidant function, vitamin E helps maintain the integrity of red blood cells, muscle tissue, and other organs that are especially susceptible to oxidative stress. Dietary sources of vitamin E include vegetable oils, like wheat germ, sunflower, and safflower oils, nuts, seeds, green leafy vegetables, and fortified cereals. Deficiency of vitamin E is quite rare and usually occurs in individuals with fat malabsorption disorders such as cystic fibrosis, cholestatic liver diseases, or in premature infants with very low birth weight. The hallmark of vitamin E deficiency is hemolytic anemia due to increased fragility of red blood cells exposed to oxidative stress. Symptoms may also include peripheral neuropathy, muscle weakness, and impaired immune responses, reflecting the widespread cellular damage caused by oxidative stress. Clinically, vitamin E is considered important for its protective effects against chronic diseases like cardiovascular disease and neurodegenerative disorders, although supplementation beyond dietary amounts is not universally recommended without medical supervision. Importantly, vitamin E supplements in excessive amounts can interfere with blood clotting by antagonizing vitamin K, increasing the risk of hemorrhage. For NEET students, remember, vitamin E is a crucial antioxidant protecting cell membranes, and its deficiency primarily leads to hemolytic anemia and neurological symptoms, mostly seen in conditions with fat malabsorption. Now, let's focus on vitamin K, another fat-soluble vitamin essential for blood clotting and bone health. Vitamin K exists mainly in two forms: vitamin K1 phylloquinone, found in green leafy vegetables like spinach and kale, and vitamin K2, menaquinones, produced by bacteria in the human gut and also found in fermented foods. The primary biological role of vitamin K is as a cofactor for the enzyme gamma-glutamyl carboxylase, which carboxylates specific glutamic acid residues on clotting factors, specifically factors 2, prothrombin, 7, 9, and X, as well as proteins C and S, which are natural anticoagulants. This carboxylation is crucial because it enables these proteins to bind calcium ions, a necessary step for their proper function in the coagulation cascade. Without vitamin K, these clotting factors are produced but remain inactive, leading to impaired blood clotting. Deficiency of vitamin K is relatively uncommon but can occur in newborns due to poor placental transfer and sterile intestines, patients with fat malabsorption syndromes, or those on prolonged antibiotic therapy that disrupts gut flora. Clinically, vitamin K deficiency manifests as bleeding diathesis, easy bruising, prolonged bleeding times, and in severe cases, hemorrhagic disease of the newborn. Because of this risk, newborns routinely receive vitamin K injections shortly after birth as a prophylactic measure. In addition to coagulation, vitamin K is involved in the carboxylation of osteocalcin, a bone protein important for calcium binding and bone mineralization, highlighting its role in bone metabolism. Oversupplementation of vitamin K is rare and generally not toxic, but it can interfere with anticoagulant therapy such as warfarin, which works by antagonizing vitamin K activity. Now, we begin our exploration of the water-soluble vitamins, starting with vitamin B1 or thiamine. Thiamine is an essential coenzyme in carbohydrate metabolism. Its biologically active form, thiamine pyrophosphate, TPP, serves as a cofactor for several key enzymes, notably pyruvate dehydrogenase, which links glycolysis to the Krebs cycle, alpha-ketoglutarate dehydrogenase, an enzyme of the Krebs cycle, and transketolase, which is involved in the pentose phosphate pathway. Because thiamine is critical for energy production, tissues with high metabolic demand, such as the brain and heart, are especially sensitive to its deficiency. Dietary sources include whole grains, legumes, nuts, meat, especially pork, and fortified cereals. Thiamine is water-soluble, meaning the body does not store it in large quantities, so a continuous dietary supply is necessary. Deficiency of thiamine leads to a spectrum of clinical disorders, most notably Beriberi and Wernicke-Korsakoff syndrome. Beriberi exists in two main forms. Wet beriberi affects the cardiovascular system, causing high-output heart failure, tachycardia, edema, and peripheral vasodilation. Dry beriberi primarily affects the nervous system, leading to symmetrical peripheral neuropathy characterized by muscle weakness and paresthesias. Wernicke's encephalopathy, often seen in chronic alcoholism, presents acutely with confusion, ophthalmoplegia, eye movement abnormalities, and ataxia, lack of coordination. If untreated, it can progress to Korsakoff psychosis, characterized by severe memory impairment and confabulation. These neurological manifestations reflect thiamine's role in neural metabolism and neurotransmitter synthesis. Diagnosis can be supported by measuring transketolase activity in red blood cells. Treatment involves prompt thiamine supplementation, often intravenously in severe cases. From a public health perspective, thiamine deficiency remains a significant problem in regions where polished rice is a staple because the milling process removes the thiamine-rich outer layers. For NEET students, understanding thiamine's role in energy metabolism and its deficiency syndromes is crucial, especially the neurological and cardiac presentations. This vitamin exemplifies how micronutrient deficiencies can cause multi-system disease, reinforcing the importance of balanced nutrition. Let's discuss vitamin B2, or riboflavin, a water-soluble vitamin essential for energy production and cellular function. Riboflavin is a precursor of two important coenzymes, flavin mononucleotide, FMN, and flavin adenine dinucleotide, FAD. These coenzymes play critical roles as electron carriers in various oxidation reduction, redox, reactions, including those in the electron transport chain, a central step in cellular respiration. Because of its involvement in energy metabolism, riboflavin supports growth, development, and the maintenance of healthy tissues. Dietary sources of riboflavin include dairy products, eggs, lean meats, green leafy vegetables, and fortified cereals. Riboflavin is sensitive to light, especially ultraviolet light, which can cause its degradation. This is why milk is often stored in opaque containers. Deficiency of riboflavin, also called araboflavinosis, is uncommon in isolation but can occur with other B-complex deficiencies or in malabsorptive conditions. Clinically, riboflavin deficiency manifests with symptoms affecting tissues with rapid turnover. Chylitis, painful cracks and fissures at the corners of the mouth, known as angular stomatitis. Glossitis, inflammation of the tongue, making it appear smooth and magenta-colored. Seborrheic dermatitis, scaly, greasy skin eruptions, particularly around the nose, ears, and scalp. Ocular symptoms like photophobia, itching, and bloodshot eyes may also occur. Because FMN and FAD are required for the metabolism of other vitamins, such as niacin, vitamin B6, and folate, riboflavin deficiency can exacerbate other nutritional problems. Riboflavin also plays a role in maintaining the health of the nervous system and red blood cells. In the clinical setting, riboflavin supplementation can help alleviate symptoms quickly. For NEET aspirants, it is important to associate riboflavin deficiency with angular stomatitis, glossitis, and seborrheic dermatitis. Now, let's focus on vitamin B3, also known as niacin, an essential water-soluble vitamin with critical roles in cellular metabolism. Niacin exists in two main forms, nicotinic acid and nicotinamide. Both forms are precursors to the coenzymes NAD, nicotinamide adenine dinucleotide, and NADP, nicotinamide adenine dinucleotide phosphate. These coenzymes are vital for hundreds of enzymatic redox reactions, including those in glycolysis, the Krebs cycle, and oxidative phosphorylation, making niacin central to energy production. Interestingly, niacin can be synthesized endogenously from the amino acid tryptophan, but this pathway is inefficient and depends on adequate levels of vitamin B6. Therefore, dietary intake remains essential. Dietary sources of niacin include meat, fish, poultry, nuts, and enriched cereals. Deficiency of niacin causes pellagra, a disease historically prevalent in populations dependent on corn-based diets, which are low in niacin and tryptophan. Pellagra is classically described by the 3Ds: dermatitis, symmetrical, hyperpigmented, scaly rash, especially in areas exposed to sunlight, often called the Casal necklace, when it appears around the neck. Diarrhea, due to gastrointestinal mucosal atrophy, leading to malabsorption. Dementia, neurological symptoms including confusion, memory loss, depression, and in severe cases, psychosis. If untreated, pellagra can be fatal. Niacin deficiency can also lead to glossitis and stomatitis. On the flip side, niacin is used pharmacologically to lower LDL cholesterol and increase HDL cholesterol, but excessive doses can cause side effects like flushing, liver toxicity, and gastrointestinal upset. Clinically, niacin deficiency is often seen in alcoholics and malnourished individuals. For NEET students, it's essential to remember the triad of pellagra, dermatitis, diarrhea, and dementia caused by niacin deficiency. Next, we have vitamin B5 or pantothenic acid, a water-soluble vitamin essential for numerous biochemical processes. Pantothenic acid is a key component of coenzyme A-CoA, which is involved in the metabolism of carbohydrates, fats, and proteins. CoA acts as a carrier of acyl groups, facilitating the synthesis and oxidation of fatty acids, as well as the citric acid cycle, which is central to cellular energy production. Because CoA is fundamental to energy metabolism and biosynthetic pathways, pantothenic acid is crucial for maintaining normal physiological function. Pantothenic acid is widely distributed in foods, including meat, poultry, eggs, whole grains, legumes, and vegetables like broccoli and mushrooms. This widespread availability means deficiency is rare in normal diets. However, when it does occur, typically in cases of severe malnutrition or rare metabolic disorders, it can cause symptoms such as fatigue, irritability, numbness, muscle cramps, and hypoglycemia. In experimental settings, deficiency has been associated with burning feet syndrome, characterized by burning sensations in the feet and neuropathy, especially noted in prisoners of war during World War II. Though pantothenic acid deficiency is rare, understanding its role is important, especially in relation to its function in synthesizing acetylcholine, cholesterol, steroid hormones, and fatty acids. For NEET students, remember that vitamin B5 is vital for the synthesis of coenzyme A and energy metabolism, and that its deficiency manifests primarily with nonspecific neurological symptoms such as fatigue and neuropathy. This vitamin exemplifies how coenzymes are central to metabolism and how vitamins support countless enzymatic reactions in the body. Let's now explore vitamin B6, or pyridoxine, a water-soluble vitamin with a crucial role in amino acid metabolism. Vitamin B6 is converted into its active form, pyridoxal phosphate, PLP, which acts as a coenzyme for over 100 enzyme reactions, mostly involved in amino acid metabolism, including transamination, deamination, decarboxylation, and racemization. These reactions are vital for synthesizing neurotransmitters like serotonin, dopamine, norepinephrine, and gamma-aminobutyric acid, GABA, making vitamin B6 essential for proper nervous system function. Other functions include the metabolism of glycogen, synthesis of heme, a component of hemoglobin, and modulation of steroid hormone action. Dietary sources of vitamin B6 include poultry, fish, potatoes, bananas, and fortified cereals. Deficiency of vitamin B6, though uncommon, can arise from malnutrition, malabsorption, certain medications like isoniazid and hydralazine, or genetic disorders affecting metabolism. Clinically, vitamin B6 deficiency manifests with peripheral neuropathy, numbness, tingling, and burning sensations in the hands and feet. Seborrheic dermatitis, especially around the eyes, nose, and mouth. Glossitis and cheilitis. Microcytic hypochromic anemia due to impaired heme synthesis. In severe cases, neurological symptoms like irritability, depression, and confusion may develop. Importantly, excess vitamin B6 from supplements can cause sensory neuropathy, highlighting the need for balanced intake. For NEET aspirants, the key points are that vitamin B6 deficiency presents primarily with neurological symptoms and anemia, linked to its role in amino acid and neurotransmitter metabolism. This vitamin beautifully illustrates the connection between biochemical pathways and clinical neurology. Now, let's talk about vitamin B7, commonly known as biotin, an important water-soluble vitamin that plays a vital role as a coenzyme in carboxylation reactions. Biotin acts as a coenzyme for several carboxylase enzymes including pyruvate carboxylase, converts pyruvate to oxaloacetate, a key step in gluconeogenesis. Acetyl-CoA carboxylase, involved in fatty acid synthesis. Propionyl-CoA carboxylase, helps metabolize certain amino acids and fatty acids. Because of these roles, biotin is crucial for energy production, fatty acid metabolism, and maintaining normal glucose levels. Dietary sources include egg yolk, nuts, legumes, and some vegetables. It is also synthesized by intestinal microbiota, which contributes to the body's biotin pool. Biotin deficiency is rare, but can occur in cases of prolonged consumption of raw egg whites, which contain avidin, a protein that binds biotin and prevents its absorption. Certain genetic disorders affecting biotinidase enzyme, necessary for recycling biotin. Total parenteral nutrition without biotin supplementation. Symptoms of deficiency include dermatitis, particularly seborrheic and periorificial, around the mouth, eyes, and nose. Alopecia, hair loss. Neurological symptoms like depression, lethargy, hallucinations, and paresthesia. In infants, biotin deficiency can cause seizures and developmental delay. Because biotin is involved in fatty acid metabolism, deficiency can disrupt cell membrane integrity, explaining the skin and neurological manifestations. For NEET students, remember biotin's role as a coenzyme in carboxylation reactions and its deficiency signs, dermatitis, alopecia, and neurological symptoms. This vitamin exemplifies the critical link between micronutrients and metabolic homeostasis. Next, we come to vitamin B9, commonly called folic acid, an essential water-soluble vitamin with a critical role in DNA synthesis and cell division. Folic acid is converted in the body to its active form, tetrahydrofolate, THF, which acts as a carrier of 1-carbon units in various metabolic reactions. This function is indispensable for the synthesis of purines and thymidine, which are building blocks of DNA and RNA. Because of this, folic acid is especially important in tissues with rapid cell turnover such as the bone marrow, gastrointestinal tract, and developing fetal tissues. Dietary sources include leafy green vegetables, legumes, nuts, liver, and fortified cereals. Deficiency of folic acid leads to impaired DNA synthesis and consequently defective cell division, which manifests primarily as megaloblastic anemia, characterized by large, immature red blood cells, megaloblasts, in the bone marrow and peripheral blood. Clinically, patients present with symptoms of anemia such as fatigue, pallor, and shortness of breath. Additionally, folic acid deficiency can cause leukopenia and thrombocytopenia, affecting white blood cells and platelets, respectively. In pregnant women, folic acid deficiency is particularly concerning because it increases the risk of neural tube defects in the developing fetus, such as spina bifida and anencephaly. Other causes of folic acid deficiency include malabsorption syndromes, alcoholism, certain medications like methotrexate and phenytoin, and increased demand during pregnancy or hemolytic anemia. It is important to differentiate folic acid deficiency from vitamin B12 deficiency, as both cause megaloblastic anemia but have different neurological consequences. For NEET students, remember that folic acid deficiency causes megaloblastic anemia and neural tube defects, and that its active form, tetrahydrofolate, is essential for DNA synthesis. Understanding folic acid bridges biochemistry, hematology, and embryology. Now, let's discuss vitamin B12, also known as cobalamin, a complex water-soluble vitamin essential for DNA synthesis, red blood cell formation, and nervous system function. Vitamin B12 contains a cobalt ion at its core and is unique among vitamins because it is synthesized only by certain bacteria and archaea. Humans obtain it primarily from animal-derived foods such as meat, fish, eggs, and dairy products. In the body, vitamin B12 plays two critical roles. As a cofactor for methionine synthase, which catalyzes the conversion of homocysteine to methionine, a key step in methylation reactions and DNA synthesis. As a cofactor for methylmalonyl-CoA mutase, which converts methylmalonyl-CoA to succinyl-CoA, important in fatty acid and amino acid metabolism. Vitamin B12 absorption is complex. It requires binding to intrinsic factor, a glycoprotein secreted by the stomach's parietal cells, and absorption in the terminal ileum. Deficiency of vitamin B12 leads to impaired DNA synthesis and results in megaloblastic anemia, similar to folate deficiency, but with important neurological symptoms due to demyelination of the dorsal columns and corticospinal tracts, a condition known as subacute combined degeneration. Clinically, vitamin B12 deficiency presents with symptoms of anemia, fatigue, pallor, and dyspnea. Neurological symptoms: numbness, tingling, paresthesia, weakness, ataxia, and cognitive disturbances. Glossitis, similar to other B vitamin deficiencies. Causes of deficiency include pernicious anemia, autoimmune destruction of parietal cells or intrinsic factor, malabsorption such as an ileal resection or Crohn's disease, strict vegetarian diets, and certain medications. It is crucial to differentiate vitamin B12 deficiency from folate deficiency because treating B12 deficiency with folate alone can improve anemia but worsen neurological symptoms. For NEET students, remember that vitamin B12 deficiency causes megaloblastic anemia with neurological manifestations, subacute combined degeneration, and requires intrinsic factor for absorption. This vitamin exemplifies the importance of understanding physiology, immunology, and neurology alongside biochemistry. Finally, let's discuss vitamin C, also called ascorbic acid, a vital water-soluble vitamin known for its antioxidant properties and essential role in connective tissue health. Vitamin C serves several important functions. It acts as a powerful antioxidant, protecting cells from oxidative damage by neutralizing free radicals. It is crucial for the hydroxylation of proline and lysine residues during collagen synthesis, which stabilizes the collagen triple helix and is essential for maintaining the structural integrity of skin, blood vessels, bones, and cartilage. It enhances the absorption of non-heme iron from plant-based foods by reducing ferric iron, Fe3+, to ferrous iron, Fe2+, which is more readily absorbed in the intestine. Vitamin C is involved in the synthesis of certain neurotransmitters like norepinephrine and acts as a cofactor for several enzymes. Dietary sources are abundant and include citrus fruits, oranges, lemons, strawberries, tomatoes, green leafy vegetables, and potatoes. Deficiency of vitamin C results in scurvy, characterized by impaired collagen synthesis. Clinically, scurvy presents with weakness and fatigue due to impaired iron absorption and anemia, petechiae and purpura because of fragile blood vessels and poor wound healing, swollen, bleeding gums and loose teeth due to defective connective tissue, corkscrew hairs and joint pain due to defective collagen in connective tissue, poor wound healing and increased susceptibility to infections. Scurvy was historically common among sailors on long voyages without fresh fruits or vegetables. Vitamin C deficiency is rare today, but can occur in malnourished individuals, alcoholics, elderly patients, or people with restrictive diets. For NEET students, it's important to link vitamin C deficiency with scurvy, bleeding gums, petechiae, and poor wound healing, all rooted in defective collagen formation. Vitamin C also exemplifies how vitamins can act as antioxidants and cofactors, bridging nutrition, biochemistry, and clinical pathology. To conclude our lecture, let's summarize the key points about vitamins and their deficiency diseases, reinforcing what you need to remember for NEET and your biology studies. Vitamins are organic compounds required in small amounts for vital physiological functions. They are broadly classified into fat-soluble vitamins, A, D, E, K, and water-soluble vitamins, B-complex and C. Today, we focused primarily on the water-soluble group and vitamin C. Understanding the biochemical functions of these vitamins helps explain the wide-ranging symptoms seen in their deficiencies, affecting the nervous system, hematopoiesis, skin, and connective tissue. Early diagnosis and treatment with appropriate vitamin supplementation can reverse many of these conditions and prevent serious complications. For your NEET exams and biology courses, focus on recognizing deficiency signs and linking them with the underlying vitamin and its metabolic role. Remember, a balanced diet is crucial to prevent these deficiency diseases, highlighting the importance of nutrition in health and disease prevention. Thank you for your attention throughout this lecture. If you have any questions or want to review specific topics, feel free to ask. Also, don't forget to subscribe to the channel for more lessons. See you.